The supraspinatus is a relatively small muscle of the upper back that runs from the supraspinatus fossa superior of the scapula to the greater tubercle of the humerus. It is one of the 4 rotator cuff muscles and also abducts the arm at the shoulder. The spine of the scapula separates the supraspinatus muscle from the infraspinatus muscle, which originates below the spine. Structure: the supraspinatus muscle arises from the supraspinous fossa, a shallow depression in the body of the scapula above its spine. The supraspinatus muscle tendon passes laterally beneath the cover of the acromion. Research in 1996 showed that the posterolateral origin was more lateral than classically described. The supraspinatus tendon is inserted into the superior fascicle of the greater tubercle of the humerus. The distal attachments of the 3 rotator cuff muscles that insert into the greater tubercle of the humerus can be abbreviated as SIT when viewed from superior to inferior. The acronym SITS regarding the rotator cuff muscles is completed by including the subscapularis muscle, which unlike the other rotator cuff muscles attaches to the lesser tubercle of the humerus. Innervation: the supraspinatus muscle is supplied by the suprascapular nerve, which arises from the superior trunk of the brachial plexus and passes laterally through the posterior triangle of the neck and through the scapular notch on the superior border of the scapula. After supplying fibers to the supraspinatus muscle, it supplies articular branches to the capsule of the shoulder joint. This nerve can be damaged along its course in fractures of the overlying clavicle, which can reduce the persona unregistered trademark S ability to initiate the abduction. Function: contraction of the supraspinatus muscle leads to abduction of the arm at the shoulder joint. It is the main agonist muscle for this movement during the first 10 to 15 degrees of its arc. Beyond 30 degrees the deltoid muscle becomes increasingly more effective at abducting the arm and becomes the main propagator of this action. The supraspinatus muscle is one of the muscular tendinous support structures called the rotator cuff that surround and enclose the shoulder. It helps to resist the inferior gravitational forces placed across the shoulder joint due to the downward pull from the weight of the upper limb. The supraspinatus also helps to stabilize the shoulder joint by keeping the head of the humerus firmly pressed medially against the glenoid fossa of the scapula. Without a functioning supraspinatus, the physician must start abducting the patient's arm and eventually the patient will be able to finish abduction if the deltoid is functional, which is common because the supraspinatus is innervated by the suprascapular nerve from the superior upper trunk of the brachial plexus. The deltoid is innervated more distally by the axillary nerve, which arises from the posterior cord of the brachial plexus. Controversy about action: a 1963 study, Function of the supraspinatus muscle and its relation to the supraspinatus syndrome, an experimental in man by B. van Ling and J. D. Mulder in Leiden, Holland showed that the supraspinatus does not cause the abduction of the first 30 degrees, as widely accepted, but rather is a synergite muscle. This means that it assists the deltoid, but is not, by itself the abducting muscle. In this study, the supraspinatus was anesthetized, and the deltoid muscle was still able to complete a full range of abduction, however was not able to sustain an isometric contraction for more than 1 minute. From this study, it is suggested that the true action of the supraspinatus is to hold the capsule in position to allow greater functional strength and stamina of the deltoid muscle. In support of this study, one should also consider the basic mechanics of the forces involved in abduction of the shoulder. Supraspinatus is a smaller and weaker muscle compared to deltoid on 3 counts. Deltoid has 3 large components: anterior, middle and posterior fiber groups. Secondly, the middle fibers have a multipennate arrangement believed to pack more muscle power into a relatively compact space. Thirdly, it attaches to the deltoid tuberosity halfway down the humerus, adding to the mechanical advantage to abduct the arm. Thus the bulk, arrangement and insertion of the deltoid fibers are designed for the power needed to overcome the load of the weight of the arm plus any load in the hand. By contrast, supraspinatus is a much smaller muscle with convergent fibers leading to a tendon which attaches on the highest facet on the greater tuberosity of the humerus, thereby affording it minimal traction on the arm. The arm is a very long lever with the added weight of muscles and other soft tissues. Sharkey et al. Identified that the whole of the rotator cuff group contributes to abduction of the arm, reducing the work of deltoid by 41%. It strongly suggests that the rotator cuff acts synergically in concert with deltoid to stabilize the head of the humerus, whilst deltoid provides the turning moment at the glenohumeral joint to abduct the arm. Indeed, if deltoid is palpated when abduction is initiated, active contraction of the muscle can be detected, suggesting co-contraction of deltoid with the rotator cuff rather than after initiation by any of the rotator cuff muscles. Additional images. References. External links: Origin, Insertion and Nerve Supply of the Muscle at Loyola University Chicago Stritch School of Medicine, Supraspinatus plus Muscle at eMedicine Dictionary, Google Body, Supraspinatus muscle.